I'm Dr. Bob McGrew from Cornerstone Family Medical Group in Modesto. This video segment on the MMR vaccine, Preventing Measles, is part of a series of 3 videos dealing with MMR. The abbreviation MMR stands for 3 distinct infectious diseases: measles, mumps, and rubella. We made a video to deal with each of these infections so that you could know why immunizing young children against these viral germs is a good idea. This video is intended to supply general information. For specific decisions about your health, you should always consult with your own personal doctor. Measles is a severe infectious illness which affected almost every American before the MMR vaccine was available. It is still common in developing countries where vaccines are not widely available, and it can be very severe. In fact, the World Health Organization estimates that there were 164,000 deaths in the world from measles in 2008. The measles virus is spread most commonly through being near an infected person who is coughing, kissing an infected person, or touching things that have been coughed on, then touching your mouth without washing your hands first. This virus is extremely infectious. About 10 to 12 days after exposure to the germ, the newly infected person usually gets a fever, runny nose, and a cough. The fever can be high, often peaking at 102 to 105 degrees. Children feel pretty miserable during this stage, as you can imagine. After 2 to 4 days of fever, the rash starts. These photographs show a young boy with a classic measles rash. It begins at the hairline, then involves the head and neck. Over the next few days, it spreads down the trunk to the extremities. The third picture shows the characteristic red, blotchy pattern on the child's buttocks during the 3rd day of the measles rash. This late 1960s photograph shows a Nigerian mother and her child who is recovering from measles. Note the skin is sloughing off on the child as he heals from his measles infection. This child was among many who were cared for in camps set up during the CDC-led refugee relief effort during the Nigerian Biafran War. Measles was a constant threat in these camps. Sloughing of the skin in recovering measles patients was often extensive and resembled that of a burn victim. Due to their weakened state, children like the one shown here needed nursing care to avoid subsequent infections. About 30% of measles patients have 1 or more complications. These complications are more severe in children younger than 5 years old and in adults over age 20 and in pregnant women. The complications include ear infections, diarrhea, pneumonia, brain inflammation, which is called encephalitis, blindness, and death. Historically, measles influenced California history very strongly. There was a large Native American population present in California at the time of contact with the Europeans in about the 1500s. These Native Americans had never come in contact with measles, so none of them, including the adults, had any natural immunity to measles. The European settlers brought these diseases to California, and the severe viral diseases of measles and smallpox were responsible for wiping out up to half of the Native American peoples in the next few decades. Before an effective measles vaccine became available in 1963, there were 3 to 4 million cases of measles annually in the U.S., with annual deaths ranging from 500 to several thousands of people. By 1983, there were only about 1,500 cases reported in the entire country. That was a great testament to the effectiveness of the vaccine, and by that time, millions of measles infections and thousands of deaths had been prevented by the widespread use of the MMR vaccine. The measles vaccine is presently not available as an individual vaccine. It is only available in the MMR formulation. See our videos on mumps or rubella for more information on those diseases. This vaccine is called an attenuated live virus vaccine. meaning that the person's body is stimulated to make protective immunity through receiving a form of measles virus that causes a mild infection. This mild infection usually does not cause any symptoms. This vaccine is recommended to be given to children as part of the routine immunization series. It is given at 12 to 15 months of age, and then a second dose is given at 4 or 5 years of age. More than 99% of people who receive 2 doses of vaccine develop protective immunity. The immunity appears to be lifelong for most people. This vaccine is also recommended for adults who were born in 1957 or later and have never yet had a dose of measles vaccine. Please view the video on mumps in this series for information on possible side effects of the MMR vaccine, or for a list of people who should not take the vaccine. With regard to measles vaccine, one persistent concern for some people is a question that was raised in a scientific publication in 1998. The lead author of this scientific paper, Dr. A.J. Wakefield, a British physician, alleged that the MMR vaccine may have been responsible for the cases of 12 children that developed autism. He claimed that measles vaccine in particular caused brain damage. However, his research could never be reproduced by any other researchers. Furthermore, it was later found that the author did not disclose that he was being funded in his research by lawyers seeking evidence to use against vaccine manufacturers. The author was disciplined, and the scientific publication retracted the article in 2010. More than 20 research projects since 1998 have not shown any connection between the MMR vaccine and the development of autism. You can review more information about the measles vaccine, including the information showing that autism is not linked to vaccines, at the website cdc.gov/vaccines/measles. I derived much of the information for this talk from the Pink Book article on vaccines at this CDC website. The mission of the CDC, the Center for Disease Control in Atlanta, is to save lives and protect people. Another website with excellent information is that of the Immunization Action Coalition at vaccineinformation.org. In finishing this talk, I need to disclose my age. You see, I was born before 1957, in the era when most kids got measles about the time they started school. One of my earliest memories is that of me and my brother Paul lying on our bunk beds at about 5 or 6 years old, covered with red spots and burning up with fever. We were fortunate and had no complications. We were both blonde in the hair about that time and probably looked a lot like this little guy. Please protect your children and the community of people around them from the severe infectious disease of measles by making sure that they are vaccinated.